after. And I will see if we have some answers in the chat and read a few. We have looking forward to visiting family, watching grandbabies grow, looking forward to more short trips around Oregon. Yes. Looking forward to meeting new people, collaborating with organizations. Looking forward to vacation next month. So many cool things are happening. So thank you so much. Please continue to share your intros and we will read them and we can move to the next slide. Okay. And shout out to my fabulous colleague, Justin, for making these slides. I love them. They're brightening my day on a Friday. So today for our agenda, we are going to have manager updates. Then we will have fiscal updates. We are going to get to hear from someone with the READ group. And we're also going to get to hear about the Community Health Equity Coalition, also known as CHEC. And then we're also going to share some events with you. So next slide, please. All right, so for manager updates, I am going to hand it over to our fearless leader, Josilia.
Thank you so much, Christine. I appreciate it. Good morning, everybody, and happy New Year. I'm digging the slides, and whoever chose the song for this morning, I loved it. It was great. My name is Cecilia Johnson. I'm one of the program managers here on the team. And I just have just a few updates today. So the first one is about the Public Health Equity Conference. I hear that things are ripping and running in the background. It is being built out so beautifully. Very excited. I got a sneak peek of the agenda, and you guys are going to love what's coming. I've heard that links and registration links may be opening up soon. We will send it out to you as soon as we have them. Things are just getting finalized. And so as soon as we get those links to register, we will send those out. But for now, please save the date, April 23rd. Your whole team is invited. We are also doing some community specific events the day before on the 22nd. So more to come, but please save the dates and we'll hopefully get some registration links out to you soon. The second thing I want to promote is our Nonprofit Association of Oregon survey. You may remember sometime before the end of last year, we had a session and we were talking about this survey. I'm not sure if Leslie is on today. I'm just gonna look through the chat. Leslie, if you're on, would you like to share a little bit more about this survey for the audience? And we'd love that. Thank you.
Sure. Good morning, everyone. Leslie Bennett, Nonprofit Association of Oregon. We are just gathering information to see how the technical support program has affected your organization over the years. So we've been working with OHA since the beginning of the pandemic to help folks and organizations with technical assistance, mainly around finance, but also HR and other things. And we have all sorts of wonderful questions that would be really useful for us to hear from you all with that survey. So please take a few minutes to complete it. It will really help inform other supports that this wonderful group might get in the future.
Yes, thank you so much. Anybody that knows Leslie knows that she is a wealth of knowledge. She has definitely helped a lot of our CBOs and our internal staff understand this work, and we just appreciate the partnership with Profit Association of Oregon. And so, if you haven't already, we'll drop the links in the chat to be able to take the survey. It is available in English and in Spanish. And it takes less than 15 minutes, I'm told, to complete it. And just another flag, there were some surveys that were halfway done. So you started, but you didn't get quite through it. And so we just encourage you to just click the link and just double check if you've completed this survey. It really does help with our programming and everything in the year to come. Okay, next up on my list is reporting reminders. So it is reporting season. This is going to be all of your activities from October through December of last year. That is due on the 31st of this month. So if you have any questions about the reporting or if you need any support, please reach out to your community engagement coordinator sooner than later so that they can provide that support to you. And if you have any questions about using your dashboard or if you need your dashboard link again, please reach out to them. Everything is done through your dashboard. So please submit all of your expenditure reports and your activity reports through your dashboard. All right, that's all of the updates that I have. One thing that I'm looking forward to is just being able to see some friends. I may be traveling to Chicago for St. Patty's Day. I don't typically do anything for St. Patty's Day, and so this will be maybe a bit of a shock to go up there for St. Patty's Day because I think it's a big celebration. So I'm still thinking about it. But if I do go, I'll be able to see some childhood friends and some friends from college that I haven't seen in a while. So that'll be fun. Back to you, Christine.
Thank you so much, Josilia, for all those updates and reminders. And I see that you dropped the links to the survey in the chat. So please, please, if you haven't had a chance to fill out the survey, please do so because it's really for your benefit. So, next slide, please. Okay, fiscal updates. Fiscal dude, Zach, I don't know if you are planning to pop on today, but if you are, now would be your time.
Yeah, thanks, Christine. Hey everybody, Zach Owens. I use he, him pronouns. I am the fiscal dude supporting the public health equity grants. And um, what I am excited about this year is an active and adventurous summer and working with a new colleague. So, um, I'll get into that because the other thing is just reports are due, reports are due, reports are due. So get them in. Um, but a lot of you have had the pleasure of interacting with Moni Pedraza, who has been um, uh, my rock in the storm, my light in the darkness, and I am going to miss her because she's been wonderful, but she is getting a promotion. She is transitioning. She's still thankfully within the public health director's office, but she is now going to be supporting our local public health authority agreements. So we've got a new individual that has taken Moni's position, and you will be seeing emails from and interacting with. And so I wanted to take this opportunity and introduce them. Welcome, Miranda Carry On. If you'd like to come on camera and say hi, we'd appreciate it.
I will also unmute. Hello, Miranda Carry On, she, they pronouns.
There it is. There's the big introduction. There's the smiling face. But you will be interacting with Miranda, so look forward to it. Anyway, that's all I've got today.
Thank you, fiscal friends. It's so exciting. Welcome to the team, Miranda, and congrats to Moni on the promotion. Well deserved for sure. We can move to the next slide, please. Okay, I am going to pass this back to Josilia to do an introduction.
Thank you so much, Christine. Hello, it's me again. I am delighted to introduce I guess we're becoming friends now, Anthony Geller with the Read Group. Anthony is here to share some information with you all, but for background, if you don't know anything about what's going on with the Read Group, allow me to share a little bit, please. So, a while ago, a group of CBOs and OHA staff worked for about 6 months with Read Group to develop a shared purpose statement for the public health equity grant that you all are working right now, a theory of change, key evaluation questions, and ideas for methods of data collection. So, this group worked really hard to create all of these different assets pertaining to this work. Now, Reed is back, and they're going to help us implement the evaluation plan that is focused on two things. The first one being collecting information about challenges and opportunities related to the grant making process. So that's anything to do with the RFGA, the application selection process, that sort of thing. And they're also going to be collecting information on the outcomes of the public health equity funding. So this is pertaining to impact that the funding has made in the community. So we're really excited to have them. We know that you all work hard serving community, doing this work day in and day out. And so what makes it even, I think, even better is to be able to see that through your stories and through the data. And so Anthony is here to kind of share a little bit more about this next phase of the evaluation plan. And we're happy to see him. With that, Anthony, the mic is yours.
Thank you so much, Josilia. Yeah, thank you for that introduction and thank you for providing that background. My name is Anthony Geller. I'm an associate with Reed Group, and yeah, I'm here to announce the launch of our new evaluation project that we are going to be partnering with OHA. And this will be looking at that public health equity grant that started a little while back. We're going to be recruiting for our data collection starting at the end of January. We're going to have two different types of data collection going on. One will be journey mapping, which is a visualization tool that we will be uh, kind of putting together through interviews. And then the other will be REM, which is ripple effects mapping, which is a little newer to me as well, but we're going to be it'll be one event closer to I think maybe the end of March where we'll have a group of CBOs sharing their experience, and all of it is to identify opportunities, like Josilia said, opportunities for improvement, pitfalls, successes, and any other thoughts that all of you CBO, all of your organizations have. And I'll be reaching out via email for interested organizations so that you can reach back out and let me know if you want to take part in this evaluation process. And yeah, that's really it. It'll be kind of an intensive process from now until March, and we really appreciate all of the organizations for not only the work that you guys do, but for thank you in advance for wanting to be part of this evaluation process as well.
Thank you, Anthony. It's very exciting. I know you mentioned two things, journey mapping, and I think something with the ripple. So these are like different ways of data collection. I
Yeah.
see Jill has turned on her camera, so I don't know if you're signaling to me that you want to share a little bit more about that, maybe.
Thank you, Josilia, and thank you, Anthony. I'm going to add just a couple of notes, and then we really want to hear questions. And I see, Mercy is here, and I know there's other people here who worked with us on the evaluation plan, and we're back. So I'm super happy to be here. Um, Community-based organizations will be compensated for their time that you spend providing information for this evaluation. So I just wanted to make sure we got that note to you. And we have, sort of, we have to kind of make sure that when we're doing the data collection, that we're getting a good representation across the state of different types of organizations doing different types of work, and really basically people with different kinds of lived experience in this program. So we're kind of like identifying that right now, but what you could expect is to get emails from Anthony asking you if you're able and willing to participate in one or the other type of evaluation. So Anthony Geller from Reed here, now you've got a face to go with this, will be reaching out to we use the word recruit. I'm going to pitch just a little. For the journey mapping, we would be interviewing you. So somebody at Reed would walk you through an interview. You wouldn't An interview where there's no right answers and you're just talking about your experiences. So it'd be things like, why did you decide to apply for this funding? Um, what was it like when you were trying to fill out this application? What was hard? What was easy? Things like that. And it could be just you, or it could be a group of people from your organization that we're interviewing just to get all that information. But we definitely want to stress that the interview will be like 45 minutes, maybe 60 minutes, and that it's not a job interview. We are evaluators. Nothing you ever say to us will get back to OHA. Nothing that whether it's positive or negative, they won't know that you said it. So that's what that interview is. And then ripple effects mapping is a group exercise. I've been through it a couple times. I'm trained in it. I probably won't be doing it, but it's a group exercise that is rooted in appreciative inquiry. And you just get to talk about the good work you're doing and listen to the good work that other people are doing. And I've never participated in one where people didn't leave like way happier than they were when they came in. So these are the methods that were selected by CBOs when we were going through the process of designing this evaluation. And we're really looking forward to being able to, sort of take this next step and hear all of the information from you.
Oh, thank you so much, Jill. That's such great context. And we're really excited to even have you back to go into this next phase. I'm excited that they're bringing these new techniques. They sound very conversational, and it sounds like you'll be able to learn more about what's happening with other people that are in the group too, and really just kind of talking like a love letter about your organization. At least the REM one sounds like that. So, if you are interested, again, Anthony Geller will be sending emails out from the Read group, probably soon-ish, and we will help amplify that as well. And if you'd like to participate, again, it's a paid opportunity to just share your experience. So, Anthony or Jill, is there anything else you'd like to add?
Yeah, I was going to. I'm sorry for not clarifying before. Somebody did ask this question in the chat, and I just want to kind of echo it. They asked if this was to learn new skills, or is this evaluation just specific to the public health equity grant? We are evaluating specifically the public health equity grant, and then those two, um, you know, data collection events, journey mapping and ripple effects mapping are going to be kind of the part of the evaluation tools that we're going to be using. And then to clarify a point that Jill made just a second ago, we will be taking all of the organizations involved. So I think there's about 197 of you guys in total, and we will be kind of separating you in terms of length of like how long you've been a part of this program. And then based off of that, we will either select you for journey mapping or ripple effects mapping. And I want to clarify that is unfortunately, just due to how we are going to go about this evaluation, you won't be able to pick which one. It does depend on your organization. I did want to clarify that, but I will be reaching out and asking your organizations if you'd like to be a part of them of this evaluation. And you will be either taking part, if you're interested, you will be either taking part in journey mapping or ripple effects mapping. So thank you.
Thank you. Thank you both for being here. We're really excited and looking forward to what comes from this evaluation process.
Thank you guys so much for having us here today.
Yes, that too.
I love this meeting. So
We'll pass it back to you, Christine.
Thank you so much, everyone. And I believe we may have additional slides to share, so we'll take a moment and pull those up. And thank you, Read Group friends. All right. Now we come to the part of the agenda where we would love to share about our partners would love to share about the Community Health Equity Coalition, also known as the CHEC. And I believe Cheryl will be sharing a little bit today. So I will pass the mic to you, Cheryl.
Hi, everyone. Some of you are familiar with the work of the CHEC. We are a grassroots organization. We are not funded. We are not staffed with paid staff. We are completely a volunteer collaborative of CBOs. We Creating Opportunities, which is the organization that I am the executive director of, is offering to once again staff it with our staff and pull together all of you as partners in the CHEC to really strategize together and work together to prepare for legislative advocacy for additional funding. So thank you. So we are a grassroots coalition of community-based organizations, so all of us interested in informing legislators about the work that we're doing and specifically what our 2025-27 OHA funding request is. Again, we are a partner. We do not represent OHA in any capacity. And the beauty of that is that we can ask for more funding than what the agency can ask for. The agency is limited to what the governor's agency requested budget suggests. And it may not be what we all need to do our work to the fullest in our communities. And so that's up to us to identify and determine and to advocate strongly for. And we did make a difference last legislative session in the funding that we received ultimately for public health modernization. And I know that we can do it again. Next slide. So again, we can share directly various ways that we make a difference in public health modernization and what that funding does in our communities and how we are addressing inequities throughout the state. So we have that direct voice from the community, and we're really excited to rally together to support the work that we're all doing. Next slide. So what do we do in CHEC? We try to make it as time friendly. In other words, not a ton of extra time that we that we know time is very, very valuable. But we use the time that we do spend together to share strategies, to share updates. Some of you might have lobbyists that you work with. You might be getting some insight from them. And they would be welcome to participate if you wanted them to. But again, identifying compelling stories from the work that we're doing. Also unifying our message. That is, now I've been involved in legislative advocacy for 15 years as a project coordinator for the DD Coalition, the Developmental Disabilities Coalition. And one thing that I know for sure out of that 15 years is that unified messaging is critically important and extremely effective. What's happy is that we have double the amount, I think more than double the amount of CBOs. When I looked on the list, we have 195 CBOs. That's a significant amount of voices, and we can make a huge difference with those voices. And we just like to check in with the group with updates as they happen and share information with OHA so they can do their work on the agency end. And we can get information from them from what they're hearing as well. Next slide. So next steps is I will be providing a legislative advocacy training early on in our process, and we'll schedule that together. But we will be sending check it out. We always like to use puns. Using check it out email alerts. As we learn things and as action is needed, then we would be sending email alerts out. And then we do check-in meetings, which will be the first and third Wednesdays at 3 p.m. starting in February. And to join, you can either put your name and email into the chat here. Just put check with it so we know for sure that that's what you're replying to. And or you can send an email to info@creatingops.org. And any support and help if you want to lead efforts within the check group to coordinate testimony or to create information pages. There's plenty of opportunities if you want to kind of jump in and contribute your talents to it. Or you can just be there to learn what's going on in the advocacy for additional funding for CBOs and participate as you can. So there's not a huge amount of commitment, but we love to energize the effort to get more funding for our work. And I think that's everything.
I have
Sorry
to
for fast talking.
I have to jump in and say thank you so much, Cheryl, for just being here today. This is an incredible group. When I tell y'all, like this group, there were 20 CBO leaders, and I see Dr. Sandra has her hands up, so I'm gonna pass it to you just a second because I know you have stuff to share. But 20 CBO leaders went to the legislator and advocated on behalf of this work, just sharing stories on why public health modernization, public health work is important and why it should be pushed to the top of the agenda. And literally, that is the reason why we have a second cohort for this work. $16 million was added into this work because of people in this room right now who went and advocated, and some of which who had never done that before, ever in their life. So I'm going to pass it to Dr. Sandra, but I just had to like give you your flowers. And I know there are a lot of people in this very room who have worked with this group. So if you'd like to share anything, please raise your hand and we'd love to hear your experience. Dr. Sandra.
That's exactly what I'd like to do, Josilia, to talk about our experience 2 years ago. And thank you, Cheryl, for coming back again. I just sent you this, comment there. And I like really to give just a kind of a testimony. Please join us. it was so incredible. You know, we knew everybody has busy agendas, especially this time. For you to have an idea, we already have 6 bills on perinatal health with a senator and a few others for tobacco prevention. However, if we don't advocate together and support our general public health, which is the equity fund, how can we do everything we are doing? We have to keep going. So I'm not asking, please, I'm asking you, come and join of doing some advocacy. It was amazing. And I wish, we will have more people. Yes, we are 20 this year. How many? Maybe 40. Let's double it. And Josine, I just want to call your attention that I saw sometime that Mercy has her hands up. I don't know if she did talk and she still want to say something. Maybe not. Thank you.
Thank you, Dr. Sandra. Mercy, if you're still in the room, and I'm sorry, I might have missed your hand. So if you'd like to share anything, please, the floor is yours.
Thank you, Dr. Sandra, for saying that here, but Jessica is too busy, so I can't blame her. So I appreciate that. My question was to the read group and also this next one I just came out, they are all interested information. My point I wanted to make here is that it doesn't matter who come here to do their pitch. I would like for them to come back to give us update on previous pitches. I mean, then you know that the work that you've done with them had impact or not. And this is my request for this 2025. Otherwise, we don't want to just come here and listen to pitches and don't know the result of those pitches.
Absolutely. Yeah.
I was in a really good before. I need to know what happened to all the work we did.
Yeah. Yeah.
Before you can tell me about something else.
Yeah. Yeah. Thank you,
I don't
Mercy,
want to be
very
rude
much.
to come to a meeting and just see the topic and just run away from here.
Yeah. Yeah. Yeah.
This
Absolutely.
is my pitch to the people that are maintaining this site.
Yeah. Yeah.
Anybody, especially for the 115 waiver group that came here and told us what they were doing with that project, and now they are sending everybody to 211 info instead of sending them to their CBO that they wanted to work with. We need updates. So go back to your database, tell your managers that everyone that have come here before to pitch, the next time they come back here, they should come back to give us results before the next pitch. Because I'm confused at this point. This year, I want to use my time wisely and not just put it in things that I'm not getting outcome. I like this one because last year when we all went to Salem to do the work of advocating and to hear the outcome of that, and then the next one, it makes sense. Let's just, how things flow. I'm confused. I'm here for fiscal. If you're here to treat me about something else, you're not talking about fiscal, I don't know what to be. I don't know what to do. I got
I hear you,
expectation.
Mercy.
I'm sorry.
I hear you, Mercy. But you know what? The direct impact, you're right. The direct impact of the check work with the groups that went and everybody that wrote letters, called, is right here in the room. Like the cohort 2 CBOs is direct evidence of the advocacy that was done through check, through these CBOs. And so I hear you. And I would say in response to the read group, so Jill, I think she was going to respond to your original point.
Yes. Thank you so much, Mercy. I totally, I can totally relate to what you're saying. And we're kind of the same way. We're in and out of projects. Unfortunately, the result of our work that you all worked on and Mercy, we worked together on is not as sexy as $16 million. It's an evaluation plan. And Anthony will send that plan out to everyone in this group. I mean, when you're an evaluator and you're working on an evaluation, sometimes your result is a report or a plan. So we all worked together last year to make a plan, and now we're implementing that plan. So the work that you put into, I mean, Mercy, you showed up every week for weeks on end. I know, to make that plan. So the result of that plan and the next step is now we're going to implement that plan. And from there, we are going to be able to share like real exciting results. We're going to be able to share with you, with OHA, with the legislature, the work that everyone is doing in a way that we are very excited about. And thank you again for like kind of like calling that out and saying, hey, we need to see those results. Evaluation is kind of painstaking, and I know you're not living it every day like I am. So thank you again, Mercy, for your direction there.
Well, I appreciate that. I just hope that the people that manage this platform will also understand the point that I'm making. Because sometimes we don't just want to talk because people want to hear us talk as angry Black women or angry white women or whatever it is, but we have point to make. And if we make those points, we need to understand what happened to those points that we made. Okay, group 50% said this and 20% said this, but we decided to put everything together and go this way. And based on that, now we have session 2. Based on that, we have session 2 that we are going to proceed with. I don't like to be in it. I don't have all the time. I'm not being paid by OHA here or the government for talking about big money. I have to say and figure out how I'm going to get paid to be in these meetings.
Yeah.
And even being paid is like, okay, you and your husband has to make X amount of dollars before you can get our $35 an hour that you're going to get here. Auto restriction, I don't care about those things. They just, people keep managing people on what they can do and cannot do with their lives. But I'll go for now because the way you guys.
Oh, thank you so much, Mercy, for sharing your honest feedback. Like, definitely hear you. Definitely, I'm hearing you say more intention and anality behind feedback loops. And that sounds like something that we can definitely do more of. And so, thank you in advance to Jill and Anthony for sending out the results from the first read conversation that a lot of you were a part of. Thank you in advance for sending that out. And I'm going to pass it over to Dr. Sandra because I see her hand is up.
Josila, I just want to compliment for us to remember that this year we are beginning a whole new administration in the country. And we don't know how this legislative session is going to be. So while there are many things we are already looking at, our communities impact, especially immigrants and refugees, but coming back to the aspects of getting together and go there or send letters, whatever we can do, right, for the legislature is quite important because don't forget, 2023, we were in a very, very bad situation when the legislators walk out of the session. They were not supporting the governor. So we have to look at this together. It's more important than we can even imagine sometimes to back up the work we are all doing collaboratively. If we are almost 200 or 200, wow. Some of us have to work together, and it's not being there. Don't knock in the head of any legislator because we cannot do this kind of a thing. This is not our place, but we can educate. We can get together.
Thank
I'm sorry,
you.
this is Evelyn. I'm sorry, I don't
Yeah,
see a
please go, Evelyn.
raise
Yes.
hand feature. I'm traveling. I'm always traveling, trying to do something, get something done. I hosted our last pre-breakfast legislation, right, because I'm right down the street from the Capitol. I will gladly host it again. And just wanted to say the impact that our collective voice makes produced cohort 2. So the impact, and I paused because sometimes we glaze over the foundational work of others, and we don't recognize that collectively we could have a cohort 3. Anyway, that's what I'm saying in this meeting this morning. So it's really, really important that we do listen to one another's voice, and then we can collectively present a written letter like we did in 2023 to impact community. Thank you.
Thank you, Miss Evelyn. Yes, I mean, people coming together, opening doors, hosting breakfasts, getting together, learning how to do this. I think that's the power of this group coming together, and the power of Cheryl kind of like offering this space is because you don't have to have any experience. And in fact, many did not have experience in going to the legislator. And so the training that you'll get to do, you can use it forever. You can continue to do this. And so please, if you're interested, please connect with Cheryl. Please reach out, and or she said if you want to connect, just put your name in the chat, put check so she knows you're talking to her, and she'll grab those emails as well, so that you can get connected in. And just thank you. Thank you for being here. Thank you to Sandra and Mercy and Evelyn for sharing your experiences with this. And it makes a difference. It makes a huge difference to this work. Okay, I'm going to pass it back to Christine because I think we do still have a few more slides, right?
Yes, we do. Thank you, everyone, for sharing. We are going to touch on a few upcoming events. Okay. The first one we have up is the Community Partnership Program. And it looks like Justin was able to drop a link in the chat about this. The OHSU Night Cancer Institute Community Partnership Program is pleased to announce that a tiered grant funding cycle is now open. So this is a potential funding opportunity. And thank you so much. The next event that we wanted to just share with you is the Path Forward Health Justice and Belonging 2025 conference. This is February 5th and 6th. And I don't know if we have anybody that is here to speak on this, but we have also dropped a link in the chat to find out more information about that as well. Perfect. Thank you. The next thing we wanted to share about is the Truth Initiative Youth Cessation Best Practices. And this is a webinar on best practices for supporting youth and young adults in tobacco recovery.
Christine, this is Karina. I can speak on it a little bit more too.
Thank you.
Of course. Good morning, everyone. My name is Karina Guzman. My pronouns are she, her, and I'm a community engagement coordinator with the community engagement team. My camera is off today. But I wanted to share, we are in partnership with the Oregon Youth Cessation, with Truth Initiative. We will be hosting and we're offering this training for all CBOs to attend, titled Oregon Youth Cessation Best Practices. And this will be a webinar on best practices for supporting youth and young adults in tobacco recovery and Truth Initiative cessation tools that can help. So the first webinar will take place on Tuesday, January 28th from 10 a.m. to 11 a.m. So it's just 1 hour. There will be live interpretation in Spanish. And there will be another webinar on Thursday, February the 6th. And these two sessions will be the same information, same session, just offered at a different time. So we highly encourage you to attend, whether you are funded for tobacco prevention or not. Please feel free to register. We know that a lot of folks have reached out to us and shared more about the concerns that they see of youth tobacco uses in their communities and with all the different ways that people have access to that. So again, this will be January the 28th at 10 a.m. And I believe the link is posted in the chat to register. So we look forward to seeing you there. Thanks, Christine.
Thank you so much, Karina. Thank you for all that wonderful information on that. And the link is in the chat. And it sounds like you can sign up for either session that might work better for you. But we hope you can attend that as well.
And oh, I'm sorry, one clarification. The link for the February session is not available yet. So the link shared in the chat is just for the January 28th session. But keep in mind that if you're not able to attend that, we will be sending and sharing one for the February the 6th at another time. So whichever works for you best. Thanks, Christine.
Thank you so much for clarifying that, Karina. All right. And we also have so many exciting program-specific gatherings coming up for our partners. You may have seen this in your email, and it looks like Josilia came off to maybe speak a little bit more about this. So I'll pass it to you.
I'd be happy to. So many of you have been participating in these gatherings that Met Group has done throughout the past few months. And based on your feedback, they heard you loud and clear. They heard folks say, we want to connect with people that are funded for the same thing as us and just learn about their projects, network, kind of build community with those that are funded for the same thing. And so they have created a series of program-specific convenings, with the first one being next week. The topic is emergency preparedness. So they've asked that if you are funded for these areas to please register if you're interested. It's more of a networking thing. So if you're not funded for a certain area, you probably won't get as much out of it. And so they say, please, if you're funded for climate resilience, join the climate resilience one, so on and so forth. For many of you might notice that the tobacco prevention isn't on here on this list. It's because they're doing a special collaboration with the OHA tobacco team. And so they are going to send out direct communications about that convening space to those that are funded through commercial tobacco prevention. That's going to be a little bit separate from the Met Group. So you can see a lot is coming. The bulk of it is in February, but the first emergency preparedness one is next week. And thank you, Justin, for dropping the link to the program-specific convenings. You can use that one link to register for whichever area you're funded for. So thanks, Christine. I'll pass it back to you.
Thank you so much, Josilia. Super exciting networking convenings there. And it looks like we have come to the end of our presentation, and we have just a few minutes left. So I think we can stop sharing slides, and just want to say thank you so much to everybody that came here today. Do we have any last minute thoughts, questions, or concerns before we wrap up in a few?
It's so good to see these faces. It's so good to see your faces in this new year. So appreciative of you all. Thank you.
Absolutely. Thank you, everybody, for showing up today and being your authentic self and sharing. And we appreciate you so much. And I hope you have a very healthy and safe weekend. We'll see you again soon. Take care, friends.
Bye, all.
Gracias. Thank you.
Thank you.